Welcome back for those of you who are here this morning for the workshops. I hope you enjoyed yourselves. Did you have a good time? Yeah? Yeah? And just so I can have an idea, who wasn't here this morning when I gave the introduction? So quite a few. So you'll have to excuse me, the people who were here this morning, if there's a little bit of repetition. My name's Sarah Eager, and I'm a medical advisor to the Janki Foundation and an old age psychiatrist in North London. And I've been very interested in spiritual aspects of healthcare for a long, long time. In fact, when I was a medical student, I remember going along to some meditation classes because I was interested in this. And the very same week I started learning to meditate, I met a man in a shop who was very disfigured, had a lot of extreme facial scarring, and of course, the curiosity got the better of me, and I said, "Do you mind me asking, what happened to you?" And he told me this story of how he'd been in a tram which was run into by a truck which was full of petrol, and it exploded, and he had severe burns. But he said, "You know, the most amazing thing happened. I didn't experience any pain or anything. I was out of my body, I could see the whole thing, etc., etc." So that was my first introduction to this kind of experience, and I related it very much to the experience I was also having learning meditation. Of course, since that time, many patients have shared these events with me, and it's something that's quite difficult for people to talk about or really to explain within the Western paradigm of medicine. So I'm very grateful today to have our guest speaker come and share his experiences about near-death experience to help us all understand how we can integrate that experience and model of what happens, what goes on in a near-death experience, and try to understand it both from the spiritual side and the scientific side. Before I do that, I'd just like to, I've been told to remind everyone to turn off your mobile phones because it does interfere with the mic system. And I'd also just like to let you know that unfortunately Daddy Janki cannot be with us today. She is still in India because as she's over 90 and she had some health problems, she was grounded. And we're very fortunate that Sister Genti is here, who would normally have translated, and Sister Genti will be speaking in her place. And Genti conveyed to us that Daddy herself very much wanted to be here and sends us all her best wishes, but she too has to obey her doctor's instructions. So we're sending her lots of love and good wishes from us. Just a little bit about the Janki Foundation. It is a healthcare charity. It's obviously associated with the Brahma Kumaris, but a separate charity. And it was set up originally to support the Global Hospital for Healthcare in Mount Abu in Rajasthan, where our headquarters are, the headquarters of the Brahma Kumaris is. And so it was a charity set up really to support their outreach work, their work with malnutrition, with tuberculosis and various other illnesses that are very endemic in that area. But as the president of the foundation, Daddy Janki, said, that's all very well, giving physical service, but you should also be helping people understand the full model of healthcare, the full model of what it is to be a human being, which is mind, body and spirit. So as part of that remit, we do have these educational activities, we have these seminars and talks, and we have established a training program called Values in Healthcare, a Spiritual Approach. And I mentioned quite a bit about that earlier, but if anyone is interested, there are leaflets downstairs. But this is a program of training for healthcare practitioners themselves to understand how to support yourself and to use what we call spiritual tools. So to use meditation, visualization, creativity, play, movement, different things like that in order to sustain and support yourself in what is becoming a profession or an area of life that's getting more and more stressful by the minute. I can speak from my own experience. So we felt there really is a need to balance that, all the expectations and demands on healthcare professionals, with something that nurtures them. And of course, a direct offshoot of that is it helps patients as well. So without any further ado, I think they're all the main things I need to cover. I'd like to introduce Dr. Pim van Lommel. And we like to call him Dr. Pim because that's much easier to say. But that is his first name. And Pim is a cardiologist by training, and he'd worked for over 26 years in an 800-bed teaching hospital in Holland. But for the last 20 years, he's also developed a deep interest in the near-death experience. And he's now taken that on as a full-time research project. He's written many articles, several chapters. I think he's written one book and he's in the process of writing another. And in 2001 he had a paper on this subject published in The Lancet, which is really quite an achievement. To get something of this kind of, in this kind of area published in The Lancet is quite remarkable. And I think he's very well placed to explore this area of where science and spirituality meet. So I'd like to invite you, Pim, to come up onto the stage and share with us your thoughts.
Thank you, Sarah. Ladies and gentlemen, I first would like to thank Lady Janki and Sister Janti and Margaret Barrett for a kind invitation to give a lecture here today at the Understanding the Near-Death Experience event organized by the Janki Foundation for Global Healthcare. I feel very honored to be here, and I'm pleased that I get the opportunity to discuss my concept about the continuity of our consciousness based on scientific research on near-death experiences in survivors of cardiac arrest. I first would like to discuss some general aspects of near-death experience. And after that, I would like to talk about our recently published study in The Lancet on near-death experiences in survivors of cardiac arrest. And I will compare our study with two recent prospective studies from the UK and the USA. And I will talk about some elements of the NDE, near-death experience, and about the neurophysiology in cardiac arrest and in a normal functioning brain. And finally, I will discuss implications for consciousness studies and how it could be possible to explain the continuity of our consciousness. Important questions are: how is consciousness related to the integrity of brain function? Is it possible to gain insight in this relationship? And is there a biological basis for consciousness anyway? Consciousness presents timely as well as everlasting experiences. Is there a start or an end to consciousness? Let us first ask some questions about consciousness. Where am I when I'm asleep? Where is my consciousness during sleep? Should we consider the possibility of conscious experience during coma? In a recent paper in Science about detecting awareness in a patient in vegetative state, appropriate neural responses during neuroimaging techniques similar to healthy volunteers were seen following spoken instructions to perform mental imaginary tasks, which represents a clear act of intention. And this confirms beyond any doubt that this patient in vegetative state was consciously aware of herself and her surroundings. Recently, several books were published in the Netherlands about what patients had experienced in their consciousness during coma following severe traffic accident, or during coma following complications with cerebral hypertension after surgery for a brain tumor. this last patient being declared brain dead by his neurologist and neurosurgeon. But fortunately, the family refused to give permission for organ donation, and after 3 weeks of coma, he regained consciousness. These patients reported that during the period of their coma, they had experienced clear consciousness with memories, emotions, and perception out and above their body, also seeing nurses and physicians and family in and around the ICU. Does brain death really means death, or is it just the beginning of the process of dying that can last for hours to days? And what happens with consciousness during this period? According to the many reports of an NDE, we should consider the possibility that someone can experience consciousness during cardiac arrest. But should we also ask ourselves whether there could be still consciousness after someone really has died, when his body is cold? He who wants answers will have to ask questions. And are our concepts about death correct? Most of us believe that death is the end of our existence. We believe that it is the end of everything we are. We believe that the death of our body is the end of our identity, the end of our thoughts and memories, that it is the end of our consciousness. And could the fear of death not be based on this ignorance about what death could be? So, what is death? Do we have to change our concept about death, not only based on what has been thought and written about death in human history, around the world, in many cultures, in many religions, and in all times, as shown in this painting from 1480 by the Dutch painter Hieronymus Bos, showing deceased people escorted through a tunnel to the light. But also change our concept about death based on insights from recent scientific research on NDE. In 1969, during my rotating internship, a patient was successfully resuscitated in the cardiac ward by electrical defibrillation. The patient regained consciousness and was very, very disappointed. He told me about going through a tunnel, seeing a light, and also beautiful colors and hearing music. I've never forgotten this event, but I did not do anything with it. Years later, in 1975, Raymond Moody first described the so-called near-death experiences, NDE. And only in 1986, I read about these experiences in the book by George Ritchie entitled Return from Tomorrow, which relates what he experienced during a period of clinical death of 9 minutes duration in 1943 during his medical study. And after reading this book, I started to interview my patients who had survived a cardiac arrest. And to my great surprise, within 2 years, 12 patients out of 50 survivors of cardiac arrest in the past told me about their NDE. So my scientific curiosity started to grow because, according to our current medical concepts, it is not possible to experience consciousness during a cardiac arrest when circulation and breathing have ceased. So, what is an NDE? Some people who have survived a life-threatening crisis report an extraordinary conscious experience. And near-death experiences occur with increasing frequency because of the improved survival rates resulting from modern techniques of resuscitation. An NDE can be defined as a reported memory of the whole of impressions during a special state of consciousness, including a number of special elements such as out-of-body experience, pleasant feelings, seeing a tunnel, a light, deceased relatives, or a life review. And many circumstances are described during which an NDE are reported, such as cardiac arrest, clinical death, shock after loss of blood, coma following traumatic brain injury of intracerebral hemorrhage, near drowning, especially children, or asphyxia, but also in serious diseases not immediately life-threatening or during depression or without any obvious reason. Similar experience to near-death ones can occur during the terminal phase of illness and are called deathbed visions. The NDE is transformational, always causing profound changes in life inside and the loss of the fear of death. And the content of an NDE and the effects on patients seem similar worldwide across all cultures and all times. However, the subjective nature and the absence of a frame of reference for this experience lead to individual, cultural, and religious factors determining the vocabulary used to describe and interpret the experience. And according to a recent at-random inquiry in Germany and the USA, about 4% of the total population in the Western world should have experienced an NDE. So more than 2 million people in the UK must have had an NDE. So why do we physicians hardly ever hear a patient tell about his NDE? Patients are so reluctant to share their experience with others by all the negative responses they get. You have to be open to hear about an NDE. Patients must feel that you trust them, that you can listen without any comment or prejudice. Once a conference was held about NDE in a university hospital, with more than 300 people in attendance. And at the end of the conference, after several lectures about NDE, a man stood up and said, "I am a cardiologist for more than 25 years and have never heard such absurd stories. This is total nonsense. I don't believe one word of it." Then another man got up in the audience and said, "I am one of your patients. I have had a near-death experience during cardiac arrest, and you would be the last one I would ever tell." Until recently, there was no prospective and scientifically designed study to explain the cause and content of an NDE. All studies had been retrospective and very selective with respect to patients. And based on these incomplete retrospective studies, some believed that the experience could be caused by physiological changes in the brain as a result of the lack of oxygen, cerebral anoxia. Other theories encompass a psychological reaction to approaching death or a combination of such reaction and anoxia. So, in 1988, we started a prospective study of 344 consecutive survivors of cardiac arrest in 10 Dutch hospitals, with the aim to investigate the frequency, the cause and the content of an NDE. And we wanted to know if there could be a psychological, pharmacological, psychological or demographic explanation why people experience enhanced consciousness during a period of clinical death. So we studied patients who survived cardiac arrest because this is a well-described, life-threatening medical situation where patients will ultimately die from irreversible damage to the brain if cardiopulmonary resuscitation, CPR, is not initiated within 5 to 10 minutes. It is the closest model of the process of dying. And the definition of clinical death was used for the period of unconsciousness caused by the lack of oxygen or anoxia of the brain due to the arrest of circulation and breathing that happens during ventricular fibrillation in patients with acute myocardial infarction. And we did a short standardized interview with sufficiently recovered patients within a few days of resuscitation and asked whether they could remember the period of unconsciousness and what they recalled. In cases where memories were reported, we coded the experiences according to a weighted core experience index. And in this system, the depth of the NDE was measured according to the reported elements of the content of the NDE. The more elements were reported, the deeper the experience was and the higher the resulting score was. We found that 282 patients, 82%, had no recollection of the period of cardiac arrest, of the period of unconsciousness. But 62 patients, 18%, reported some recollection of the time of clinical death. And of these patients, 41, 12%, had a core experience with a score of 6 or higher, and 21, 6%, had a superficial NDE. And in the core group, 23 patients, 7%, reported a deep or very deep experience with a score of 10 or higher. And in our study, about 50% of the patients with an NDE reported awareness of being dead or had positive emotions. And about 25% of the patients had an out-of-body experience. 30% reported moving through a tunnel. About 25% had communication with the light or observed colors. About 30% of the patients had an observation of a celestial landscape or a meeting with deceased relatives. 13% experienced a life review, and 8% experienced a border. So all the well-known elements we found back in our study. But what might distinguish the small percentage of patients who report an NDE from those who do not? We found, to our surprise, that neither the duration of cardiac arrest, nor the duration of unconsciousness, nor the need for intubation in complicated CPR, nor induced cardiac arrest in electrophysiological stimulation, EPS, had any influence on the frequency of NDE. Neither could we find any relationship between the frequency of NDE, gender, and administered drugs, fear of death before the arrest, nor foreknowledge or NDE, gender, religion, or education. NS is not significant. And an NDE was more frequently reported at ages lower than 60 years, and patients with memory defects induced by lengthy CPR reported less frequently an NDE. Good short-term memory seems to be essential for remembering an NDE. And we additionally performed a longitudinal study with taped interviews of all late survivors with NDE 2 and 8 years following the cardiac arrest, along with a matched control group of survivors of cardiac arrest who did not report an NDE. This study was designed to assess whether the loss of the fear of death, the transformation in attitude toward life, and enhanced intuitive sensibility is the result of having an NDE or just the result of a cardiac arrest itself. Only patients with an NDE did show this transformation, and the long-lasting transformational effects of an experience that lasts only a few minutes was a surprising and unexpected finding. As I have said before, several theories had been proposed to explain an NDE. However, in our prospective study, it could not be shown that physiological, psychological, or pharmacological factors caused these experiences during cardiac arrest. With a purely physiological explanation, such as lack of oxygen to the brain, cerebral anoxia, most patients who had been clinical dead should report an NDE, because all patients in our study had been unconscious because of lack of oxygen to the brain, resulting from the cardiac arrest. However, only 18% reported an NDE. And another theory holds that an NDE might be a changing state of consciousness, transcendence, or the theory of continuity, in which memories, identity, and cognition, with emotion, function independently from the unconscious body, retain the possibility of non-sensory perception. Obviously, during NDE, enhanced consciousness is experienced independently from the normal body-linked waking consciousness. In 3 prospective studies with identical study design, our Dutch study, the study from the USA by Bruce Grayson, and the British study by Sampania and Peter Fennick, about the same percentage of NDE was found in a total of 523 patients. Grayson writes in his comment that no one physiological or psychological model by itself could explain all the common features of NDE. The paradoxical occurrence of heightened lucid awareness and logical thought processes during a period of impaired cerebral perfusion raises particular perplexing questions for our current understanding of consciousness and its relation to brain function. A clear sensorium and complex perceptual processes during a period of apparent clinical death challenge the concept that consciousness is localized exclusively in the brain. And Sampania and Peter Fennick write that the data from several NDE studies suggest that the NDE arises during unconsciousness. And this is a surprising conclusion because when the brain is so dysfunctional that the patient is deeply comatose, those cerebral structures which underpin subjective experience and memory must be severely impaired. Complex experience such as are reported in the NDE should not arise or be retained in memory. Such patients would be expected to have no subjective experience at all, as was the case in the vast majority of patients who survive a cardiac arrest. So, with lack of evidence for any other theory of NDE, the concept thus far assumed but never scientifically proven that consciousness and memories are produced by large groups of neurons and are localized in the brain should be discussed. How could a clear consciousness outside one's body be experienced at the moment that the brain no longer functions during a period of clinical death, even with a flat EEG? Furthermore, even blind people have described veridical perceptions during out-of-body experiences at the time of their NDE. Scientific study of NDE pushes us to the limits of our medical and neurophysiological ideas about the range of human consciousness and the mind-brain relation. Before I discuss in greater detail some neurophysiological aspects of brain functioning during cardiac arrest, I would like to reconsider certain elements of the NDE. First, the out-of-body experience. In this experience, people have veridical perceptions from a position outside and above their lifeless body. This out-of-body experience is scientifically important because doctors, nurses and families can verify the reported perceptions, and they can also corroborate the precise moment that NDE with OBE occurred during the period of CPR. This proves that the out-of-body experience cannot be an hallucination, because this means experiencing a perception that has no basis in reality. Neither it can be a delusion, which is an incorrect assessment of a correct perception, nor is it an illusion, which means a misapprehensive or misleading image. Should an out-of-body experience be considered as a kind of non-sensory perception? This is clearly shown in this drawing of a 6-year-old girl who nearly drowned and was resuscitated in a hospital in the United States. And ears have the feeling that they have apparently taken off their body like an old coat, and to their surprise they appear to have retained their own identity with the possibility of perception, emotions and a very clear consciousness. In this drawing you see a happy, a smiling girl watching her resuscitation from above. And this is the report of a nurse from a coronary care unit. During night shift, an ambulance brings in a 44-year-old cyanotic, comatose man into the coronary care unit. He was found in a coma about 30 minutes before in a meadow. When we go to intubate the patient, he turns out to have dentures in his mouth. I removed these upper dentures and put them onto the crash cart. After about an hour and a half, the patient has sufficient heart rhythm and blood pressure, but he is still ventilated and intubated, and he is still comatose. He is transferred to the intensive care unit to continue the necessary artificial respiration. Only after more than a week do we meet again with the patient, who is by now back on the cardiac ward. The moment he sees me, he says, "Oh, that nurse knows where my dentures are." "I'm very, very surprised," says the nurse. Then he elucidates the patient. "You were there when I was brought into hospital, and you took my dentures out of my mouth and put them onto that cart. It had all those bottles on it, and there was this sliding drawer underneath, and there you put my teeth." I was especially amazed because I remembered this happening while the man was in deep coma and in the process of CPR. It appeared that the man had seen himself lying in bed, that he had perceived from above how nurses and doctors had been busy with the CPR. He was also able to describe correctly and into detail the small room in which he had been resuscitated, as well as the appearance of those present, like myself. The holographic life review. During this life review, the subject feels the presence and the renewed experience of not only every act, but also of every thought from one's past life. And one realizes that all of it is an energy field which influences oneself as well as others. All that has been done and thought seems to be significant and stored, because one is connected with the memories, emotions, and consciousness of another person. You experience the consequences of your own thoughts, words, and actions to that other person at the very moment in the past that they occurred, an interconnectedness. They understand now the cosmic law that everything one does to others will ultimately be returned to oneself. And patients survey their whole life in one glance. Time and space does not seem to exist during such an experience. Instantaneously, they are where they concentrate upon, non-locality. And they can talk for hours to weeks about the content of the life review, even though the resuscitation only took minutes. Quotation. "All of my life, up till the present, seemed to be placed before me in a kind of panoramic, three-dimensional review, and each event seemed to be accompanied by a consciousness of good or evil, or an insight into cause or effect. Not only did I perceive everything from my own viewpoint, but I also knew the thoughts of everyone involved in the event, as if they had their thoughts within me. This meant that I perceived not only what I had done and thought, but even in what way it had influenced others, as if I saw things with all-seeing eyes. And so even your thoughts are apparently not wiped out. And all the time during this review, the importance of love was emphasized. Looking back, I cannot say how long this life review and life insight lasted. It may have been long, for every subject came up, but at the same time it seemed just a fraction of a second, because I perceived it all at the same moment. Time and distance seems not to exist. I was in all places at the same time, and sometimes my attention was drawn to something, and then I would be present there. And also a preview can be experienced, in which both future images from personal life events as well as more general images from the future occur. And again, it seems as if time and space do not exist during this preview. And if deceased acquaintances or relatives are encountered in an otherworldly dimension, they are usually recognized by the appearance. A communication is possible through thought transfer. Thus, it is possible to come into contact with fields of consciousness of deceased persons, interconnectedness. Quotation. During my cardiac arrest, I had an extensive experience. And later I saw, apart from my deceased grandmother, a man who had been looked at me lovingly, but whom I did not know. More than 10 years later, at my mother's deathbed, she confessed to me that I had been born out of an extramarital relationship. My father being a Jewish man who had been deported and killed during the Second World War. And my mother showed me his picture. The unknown man that I had seen more than 10 years before during my NDE turned out to be my biological father. Some patients can describe how they returned into their body, mostly through the top of the head, and after they had come to understand that it wasn't their time yet, or that they still had a task to fulfill. The conscious return into the body is experienced as something very oppressive. They regain consciousness in their body and realize that they are locked up again in their damaged body, meaning again all the pain and restriction of their disease. And about all the people who have experienced an NDE lose the fear of death. Quotation. It is outside my domain to discuss something that can only be proven by death. For me, however, this blessing experience was decisive in convincing me that consciousness lives on beyond the grave. And I know now for sure that body and mind are separated. Death was not death, but another form of life. All these elements of an NDE were experienced during the period of cardiac arrest, during the period of apparent unconsciousness, during the period of clinical death. But how do we know that the EEG, the electrical activity of the cortex of the brain, is flat in those patients with cardiac arrest? And how can we study this? Through many studies with induced cardiac arrest in both human and animal models, cerebral function has been shown to be severely compromised during cardiac arrest, with complete cessation of cerebral blood flow, causing sudden loss of consciousness and of all body reflexes, but also with abolition of brain stem activity, with the loss of the gag reflex and the corneal reflex, and fixed and dilated pupils are clinical findings in these patients. And also the function of the respiratory center, located close to the brain stem, fails, resulting in apnoea, no breathing. The electrical activity of the cerebral cortex, but also of the deeper structures of the brain, has been shown to be absent in 10 to 20 seconds, a flatline EEG. And in acute myocardial infarction, the duration of cardiac arrest in the coronary care unit is usually 60 to 120 seconds. And in out-of-hospital arrest, it even takes much longer. So in all survivors of cardiac arrest in the prospective studies, the patients must have had a flatline EEG. The quite often proposed objection that the flatline EEG does not rule out any brain activity because it is mainly a registration of the electrical activity of the cerebral cortex misses the mark. The issue is not whether there is any brain activity of any kind whatsoever, but whether there is brain activity of the specific form regarded by temporary neuroscience as the necessary condition of conscious experience. So we have to come to the surprising conclusion that in our study during cardiac arrest, NDE was experienced during the transient functional loss of all functions of the cortex and the brainstem, with a flatline EEG. And because of the occasional and verifiable out-of-body experiences, we know that the NDE with all the reported elements must happen during the period of unconsciousness, and not in the first or last seconds of the cardiac arrest. But how is it possible that a clear consciousness with self-identity, cognition, emotion and memories can be experienced outside one's body at the moment that the brain no longer functions during a period of clinical death? Such a brain would be roughly analogous to a computer with its power source unplugged and the circuits detached. It couldn't do anything at all. For decades, extensive research has been done to localize consciousness and memories inside the brain. So far, without any success. We also should ask ourselves how a non-material activity, such as concentrated thinking or attention, can correspond with an observable material reaction in the form of measurable electrical, magnetic, or chemical activity at a certain place in the brain. Neuroimaging studies have shown these aforesaid activities, with specific areas of the brain becoming metabolically active in response to a thought or feeling. However, although providing evidence for the role of neuronal networks as an intermediary for the manifestation of thoughts, neural correlates, those studies do not necessarily imply that those cells also produce the thoughts. And how should unconscious matter, like our brain, produce consciousness, while the brain only is composed of atoms and molecules in cells with a lot of chemical and electrical processes? We have to admit that it is not possible to reduce consciousness to neural processes as conceived by contemporary neuroscience, because it is still an unproven assumption that consciousness and memory emerge from brain function. And until now, there is no scientific evidence for neural correlates of all aspects of subjective experience. Direct evidence of how neurons of neuronal networks could possibly produce the subjective essence of the mind and thoughts is currently lacking. There are no examples of neural perceptual matches, and hence reasons to doubt of the truth of the matching content doctrine. The assumption in the matching content doctrine is that following an activation of special neuronal networks, you always will have the same content of thoughts or feelings. This seems extremely unlikely because neural activation is simply neural activation. It only reflects the use of structures. This could be compared with a radio. Activating the radio does not influence the content of the program. And neural activation alone does not explain the content of emotions or sensations. With our current medical and scientific concepts, it seems indeed impossible to explain all aspects of the subjective experiences as reported by patients with an NDE during transient loss of all functions of the brain. But science, I believe, is the search for explaining new mysteries rather than to stick with old facts and concepts. Friedrich van Eden, a famous Dutch MD and author, mentioned already in 1890 in his lecture about progress in current science, "Personally, I am more than ever convinced that the largest enemy to scientific progress is to reject and to refuse to study beforehand and out of prejudice, seeming incomprehensible, strange and unknown facts." How actual. Thomas Kuhn, the famous professor of philosophy and history of science from the MIT, maintained that contrary to popular conception, typical scientists are not objective and independent thinkers. They try to bring the theory and facts into closer agreement according to the beforehand accepted paradigm, which Kuhn described as essentially a collection of beliefs shared by scientists, a set of agreements about how problems could be understood. And as a result, scientists tend to ignore or even ridicule research findings that might threaten the existing paradigm. Those observations that cannot be explained by the current worldview are called anomalies, because they are recognized as violation of the paradigm-induced expectations that govern normal science. And so, of course, these findings are initially overlooked, ignored, or rejected as an error. Near-death experiences are such anomalies because the content and the cause of the NDE cannot be simply explained by our current medical and scientific ideas about the range of human consciousness and the mind-brain relationship. The quest to find consciousness. So it is indeed a scientific challenge to discuss new hypotheses that could explain the reported interconnectedness with the consciousness of other persons and of deceased relatives, to explain the possibility to experience instantaneously and simultaneously non-locality, a review and a preview of someone's life in a dimension without our conventional body-linked concept of time and space, where all past and present and future events exist, and the possibility to have clear consciousness with memories, with self-identity, with cognition, and the possibility of perception. Almost all reported elements of consciousness during cardiac arrest seem to have quantum-like phenomena, like non-local interconnectedness, like a higher dimensional space where every past and future event is available as a possibility. However, quantum field theory cannot explain the essence of consciousness, nor the secrets of life, but it is helpful for understanding my concept on the informational fields of consciousness. In my concept, our whole and undivided consciousness with declarative memories finds its origin in and is stored in this phase space as wave fields of information, and the cortex only serves as a relay station for parts of these wave fields of consciousness to be received into or as our waking consciousness, which belong to our physical body, particles. And so they can be considered as two complementary aspects of consciousness. This could be compared with the internet, which does not originate from the computer itself, but it is only received by it. So in this concept, consciousness is not rooted in the measurable domain of physics, our manifest world. This also means that the eternal wave aspects of our indestructible consciousness in phase space is inherently not measurable by physical means. The immeasurable can never be measured. However, the particle aspect, the physical aspect of consciousness, which originate from the wave aspect of our consciousness by collapse of the wave function, objective reduction, can be measured by means of neuroimaging techniques like EEG, fMRI, and PET scan. These fields of consciousness could be compared with the gravitational fields, where only the physical effects can be measured, but the gravitational fields themselves are not directly demonstrable. Different neuronal networks function as interface for different aspects of our consciousness, as can be demonstrated by changing images during this registration of fMRI and PET scan. So the function of neuronal networks should be regarded as receivers and conveyors, not as retainers of consciousness and memories. In this new concept about consciousness and the mind-brain relation, all reported elements of an NDE during cardiac arrest could be explained. Now, in trying to understand this concept of interaction between the invisible phase space and our visible material body, it seems appropriate to compare it with modern worldwide communication. There is a continuous exchange of objective information by means of electromagnetic fields for radio, TV, mobile, telephone, or laptop computer. We are not consciously aware of the vast amounts of electromagnetic fields that constantly, day and night, exist around us and even permeating us, as well as permeating structures like walls and buildings. At this very moment, we are invaded by hundreds of thousands of telephone calls and hundreds of TV and radio programs. We only become aware of these electromagnetic informative fields at the moment we use our mobile telephone or by switching on our TV, radio, or laptop computer. And what we receive is neither inside the instrument nor in the components, but thanks to the receiver, the information from those electromagnetic fields become observable to our senses, and hence perception occurs in our consciousness. The voice we hear over telephone is not inside the telephone. The concert we hear on our radio is transmitted to our radio. The images and music we hear and see on TV are transmitted to our TV set. And if we switch off the TV set, the reception disappears, but the transmission continues. The information transmitted remains present within the electromagnetic fields. The connection has been interrupted, but it's not vanished, and still can be received elsewhere by using another TV set, non-locality. Internet, with more than 1 billion websites, can be received about at the same moment in the USA, Europe and in Australia, and is obviously not located inside our laptop. So according to my concept, based on the universal reported aspects of consciousness experienced during cardiac arrest, we can conclude that the informational fields of our consciousness, and consisting of waves, are rooted in phase space, in an invisible dimension without time and space, and are present around us and through us, permeating our body. And they become available as our waking consciousness only through our functioning brain in the shape of measurable and changing electromagnetic fields. Could our brain be compared with a TV set which receives electromagnetic waves and transforms them into image and sound? And could it also be compared with a TV camera which transforms image and sound into electromagnetic waves? These waves hold the essence of all information, but are only perceivable by our senses to suitable instruments like TV and camera. The function of the brain should be compared as a transceiver, a transmitter-receiver. And during life, our consciousness has an aspect of waves as well as of particles. And there is a permanent interaction between those two aspects of consciousness. As soon as the function of the brain has been lost, as in clinical death, memories and consciousness do still exist, but the reception ability is lost. The connection or interface is interrupted. An enhanced consciousness can be experienced during such a period of a non-functioning brain. And this is what we call an NDE. In my concept, consciousness is not physically rooted. The concept of consciousness independent of our body is well known in Eastern countries like India and Tibet for ages. But to my surprise, this concept happens to be not even new in our Western world. Recently I came across this picture by Robert Flood, an English medical doctor who in the 17th century already located our emotional life, imaginative faculty, intellect, mental processes, memories and visions outside our brain. And the drawing clearly shows the supposed energy connections with our physical body. There are still more questions than answers, but based on the aforementioned theoretical aspects of the obviously experienced continuity of our consciousness, we finally should consider the possibility that death, like birth, may well be a mere passing from one state of consciousness to another. In a recent representative inquiry in Europe, the European Value Study, one question was asked about belief in a personal survival. In European countries, about between 48 and 59% of the population believed in some kind of personal survival, even in the former communist countries in Eastern Europe. These surprising high figures, about half of the population in Europe, which is more than 250 million people who believe in a personal survival, are in sharp contrast with the opinion of the majority of Western scientists who systematically ignore and ridicule the possibility of personal survival after physical death. The inevitable conclusion that there is a continuity of consciousness because consciousness can be experienced independently of brain function might well induce a huge change in the scientific paradigm in Western medicine and could have practical implication in actual medical and ethical problems, such as the care for comatose or dying patients, euthanasia, abortion, or the removal of organs for transplantation from somebody in a dying process with a beating heart and a warm body with a diagnosis of brain death. Such understanding also fundamentally changes one's opinion about death because of the almost unavoidable conclusion that at the time of physical death, consciousness will continue to be experienced in another dimension in which all past, present and future is enclosed. Death is only the end of our physical aspects. However, research on NDE cannot give us the irrefutable scientific proof of this conclusion because people with an NDE did not quite die, but they all were very close to death without a functioning brain. But, as I have explained, it has been scientifically proven that during NDE, enhanced consciousness was experienced independently of brain function. So we can conclude that our waking consciousness, which we experience as our daily consciousness, is only a part of our whole and undivided consciousness. And this enhanced consciousness is based on indestructible and constant evolving fields of information where all knowledge, wisdom, and unconditional love are present and available. And these fields of consciousness are stored in a dimension without our concepts of time and space. One could call this our higher consciousness, divine consciousness, or even cosmic consciousness. We know that now that what we consider as solid matter is about 99.99% empty space, a vacuum. And because of this, all our body cells, with our person's specific DNA, but also all material aspects of living nature on this planet, are continuously invaded by and in contact with these fields of information, these fields of consciousness. The interconnectedness with this enhanced consciousness can be experienced during clinical death, during a critical medical situation, which is called an NDE, or during an acute situation of apparently unavoidable death in an imminent traffic accident, a fear-death experience, or during meditation or deep relaxation, which is called enlightenment experience, or an experience of oneness, during changing states of consciousness, during regression therapy or hypnosis or isolation, or the use of drugs like LSD, or during a terminal phase of life, a deathbed vision. And the interconnectedness with these informative fields of consciousness also explains the enhanced intuition like clairvoyance, clairaudience and prognostic dreams and visions. And it also explains apparitions at the moment of death and at the period following death, like being in contact with the fields of consciousness of a dying person at a distance, the so-called perimortal experiences, or being in contact with the fields of consciousness of deceased relatives, the so-called postmortal experiences or after-death communication. Quoting from a recent death announcement, all what you have falls in decay, but what you are lives on beyond time and space. So we have a body and we are consciousness. Without a body, we still can have conscious experiences. We ask ourselves if there is a biological basis of consciousness anyway. Yes, there is a kind of biological basis for our waking consciousness, because our physical body functions as an interface. But no, there is no biological basis for a whole and undivided or enhanced consciousness. So our enhanced consciousness is rooted in the higher dimensional space, and it resides not in our brain and is not limited to our brain, because our consciousness is non-local and our brain has a facilitating function and not a producing function to experience consciousness. For me, science means asking questions with an open mind. It's very essential. Science should be the search for explaining new mysteries, rather than stick with old concepts. And he who has never changed his mind because he could not accept new concepts has rarely learned something. I can assure you that I learned quite a lot because of all those patients who were willing to share their NDE with me. They were my teachers. And I believe and I hope that in the near future, modern science will include research on subjective experience like those that occur in our consciousness, and that we will accept field concepts to understand how we are interconnected with each other and with nature on our endangered planet. We desperately need a new paradigm shift in science. And I sincerely hope that the quantum physicist Max Planck was wrong when he said in 1934, "A new scientific truth does not triumph by convincing its opponents and making them see the light, but rather because its opponents eventually die and a new generation grows up that is familiar with it." Scientific research in NDE could be a very important contribution to help to change people's mind and consciousness. We have learned that we are interconnected with each other in a kind of non-local entanglement, that each thought we have is preserved forever and influences oneself as well as others, and that after physical death our consciousness may still be experienced, because death may be a mere passing from one state of consciousness into another. To quote Dag Hammarskjöld, "Our ideas about death define how we live our life. Because as long as we believe that death is the end of our everything we are, we will give our energy towards the temporary and material aspects of our life. In our short-sightedness and our ignorance, we forget to reflect on the future of our planet, where our children and our grandchildren will have to live and survive. We forget about the sustainability, as we are now destroying and exhausting systematically our planet, just because we are living in a competitive and materialistic society. We should realize that the harm we cause to each other and to nature ultimately is harming ourselves, because we as humans are not only intensively interconnected with each other, but also with animals and plants living on this our endangered earth. We should stop thinking and acting as if we are better than others, because this will always be at the expense of children and other weak and delicate creatures around the world. The competitive elements in our society should be abandoned. We should recognize that our view of the world is wrong, because we do not realize that the world, as we see it, derives its subjective reality only from our consciousness. Because it is only our consciousness that is determining how we see this world. If we are in love, the world around us is beautiful. When we are depressed, our world is like hell. And when we are frightened, terrified by politicians and by the press, our world will be full of terror. So we have to change our personal consciousness to change the world and to change the way we live now. When the power of love becomes stronger than our love for power, our world will change. And this requires a huge change in consciousness indeed. We should all feel the responsibility for this change. And finally, I would like to quote Plato, who wrote more than 2,000 years ago, "The temporary material body is the temporary carrier of our immortal soul." Time does not exist in the immaterial world. And Plato is convinced that in communication we have to use words, but that we should realize that this is a limiting factor to verbalize the essence. The true nature of things is principally concealed and not revealed by our words. And in spite of being aware of this limitation, I've tried to use words to talk about my concepts and my feelings about the continuity of our consciousness. Thank you for your attention.
Pim, thank you very, very much. That was masterly. And I think we really experienced a wonderful tour through the clinical, the scientific, the philosophical, and the spiritual. So thank you very, very much for all the thought and your own consciousness that you imbued that talk with. We are now going to move to a section where I'd like to invite Sister Genti to join us, and we'll have a dialogue between Pim and Sister Genti. And unfortunately, because time is very tight today, we may, as part of that, have time for some questions from yourselves. But I'd like to move to the dialogue now and invite Sister Genti. Sister Genti is the European Director of the Brahma Kumaris and has represented them on many committees, UN committees. She's on the executive of the World Congress of Faiths, is an absolute multi-faith personality. And we're very lucky to have her with us today to share her thoughts on this topic. So could I invite Sister Genti to come up on the stage? So I wondered if you had any questions for each other, or maybe I could just kick off with a question. Obviously, these experiences are life-changing, these near-death experiences. And I was wondering, why are they life-changing? And also, I think the aspect that is mentioned in your writings of how people integrate that experience back into their lives, and sometimes that's quite difficult. Do you want to comment on that?
Well, the experience itself is so impressive and full of love. When they come back into their body, they're back in their body with all the disease and limitation they had before. And when you try to talk about it to nurses, to physicians, and to family, nobody believes them. But it is a kind of inner knowing. And when to express themselves in our materialistic and competitive society, it's not possible to live according to this new life insights. It's very hard. So it takes years and years to integrate this experience if they want to integrate it. And I know people who, let's say, I know a lady for more than 70 years old who had near drowning when she was 5 years old. She tried to talk about it and she stopped. And she didn't integrate at all. And then when she started talking about it for the first time when she was 72, it was so emotional for her, but it was like it happened yesterday. And as soon as you can share your experience with others, you can start to accept it and try to change your life. And one of the main things that's very hard for them is the enhanced intuition. When you regain consciousness and you feel others, you feel the emotions of others, you know sometimes if they're ill or they're going to die. You don't want to know it. It's very hard to know these kind of things. So you need years and years to accept the experience and to live according to this. And it's such a life-changing event that more than 50% of the people get a divorce because you're not the same partner anymore. So you lose your friends, you lose your partner, but you get new friends and new partners as well. But it is very hard because you're so a different person from that moment.
Do you have any thoughts, Genty, about
this?
You seem to have a lack of volume on Genty's mic.
I put it. It's on.
Firstly, I'd like to thank you, Pim, for a brilliant explanation of your research, and I see it as being such an important stepping stone in helping people come to an appreciation of spirituality and acceptance of the spiritual dimension. So thank you very, very much. And I would say that 75% of the things that you were saying confirm absolutely the things that I've been experiencing through meditation. I first heard about the NDE about 20 years ago from a woman called Margot Gray. I think Sarah knows, you also know her.
She's written a book.
Yes, that's right. And she also actually started a foundation that was an association for people who've been through that experience. She herself had been through that and then had felt what you said, you know, the alienation from society, and so she gathered together people who had been through that experience to be able to support each other. And she and I shared a platform, just as you and I are doing this now, but it was remarkable how the things that she had experienced through the near-death experience were very, very similar to what people can experience not through NDE, but just simply through meditation, in the sense that the body is here, but you're able to be aware of an existence that's quite separate and distinct from the body. And so this whole subject of brain not being the focus for consciousness, but consciousness having a separate existence to brain, I think is such a huge step forward for people in the West to understand and move away from the traditional scientific paradigm. It's really very, very valuable.
I think one area that I was curious about, Pim, in your analogy of the transceiver, receiving and transmitting, and you talk about the television or the mobile, but we know with television there is a studio somewhere, there is a kind of reality where that's happening, so there is a source where the signals are being sent from, or where that's happening, or I guess even with a mobile there's someone actually making the call. So I was curious, where do you place the source of this?
It's a good question. I think the first thing is that you need a kind of personal code on your mobile to receive this information of the hundreds of thousands of million calls or surrounded. The information in the electromagnetic fields is infinite, but it is brought into it. And consciousness is non-local, which means there's not really source, but everywhere is consciousness. And I think the new concept is that consciousness, the universe is consciousness. And we can be in contact with this non-local consciousness, which is everywhere, always. And what is so intriguing, why we are only able to receive our own personal consciousness as a waking consciousness. You have a personal reception ability for your own personal consciousness. But after an NDE, the reception ability is enhanced. You don't even receive, let's say, channel 1, your personal consciousness, but you receive channel 2, 3, and 4, the consciousness of others. And this is what we call enhanced intuition. And the difference from meditation is that I think people who meditate for years and years are able to come in contact with this enhanced consciousness or divine consciousness of the Supreme Soul, whatever you would call it. It's the same. So it's always possible to be in contact with that. The near-death experience happens to patients without any, they don't expect this to happen. And it's such a sudden event, mostly, by critical medical situations, but also walking in nature on the beach. When you meditate, you're training, but it's exactly the same. What I try to say, it's exactly the same. You come in the enhanced non-local conscious, which is everywhere. Yeah, I think you agree, or?
Yes, I would agree.
Yeah.
In the sense that my language would be different, but I think you understand. In the stage where my consciousness is locked by my physical identity, then it's very much ego-centered. And in the state where I'm able to be detached from the consciousness of the body, then in that state, yes, my consciousness is definitely enhanced. And there's a connectedness with other beings in which you're more receptive, there's an empathy with them. And then I would say that there's also another dimension, and your language was that whether you call it the divine consciousness or God or the consciousness of all around, I would say that there would be individual aspects of consciousness, and I would use the word soul. And then I would say that in that state of meditation and being out of the ego of the physical identity, there's an interconnectedness with other beings and that level of consciousness, but also there's an openness in which I can connect with one I would describe as the Supreme.
Yeah.
And so I would say that there's a difference between that one, absolute, and then others who also have a state of consciousness and different levels of consciousness.
Exactly. Yeah. But I have a question for you as well. There are only, in this kind of situation like a cardiac arrest, only 80% or 15% of people report an NDE. But the majority don't report an NDE. Do you have a kind of explanation for it?
I don't have an explanation,
No.
but I would compare it to the situation where we know by scientific research that everybody has dreams, and yet how many people are actually able to report dreams. It would be maybe a similar percentage, I think. I don't know the statistics, but I think maybe a large majority would say, well, yes, something came in the night, but what was it? I don't remember. And then a few would be able to report the dream very clearly with very specific elements. And some would say, I have a vague recollection of what happened through the night. And so I think that even if there has been an out-of-body experience, or obviously where there has been clinical death and then a revival again, so at some point there has been that separation, but then a return. But there isn't that recollection, just as it would be within the dream state, the recollection for some, but for the majority, no recollection.
So the discussion is always, do they don't remember an NDE, or did they not experience an NDE? When we look at children below the age of 4, a lot of children have had an NDE but don't remember. Some remember, even from birth or from 6 months. I've spoken to adults who had an experience very young. But when they don't remember the NDE they had as a child, near drowning, for example, they have the transformation. They have the enhanced intuitive sensitivity. They have all those aspects, but they cannot compare it with the previous. Let's say when you're 40, 50 years old, you can compare what your ideas were about society and about life, and it has changed. But as a child, you don't have an idea how it is. So when you look at children, you know that the transformation is still there, but they don't remember the experience. And for adults, when you do the longitudinal study we did, we didn't see the same kind of transformation in the people who did not report an NDE. So I don't know the explanation. Some people say that the leaving of consciousness out of the body can be in seconds, but perhaps for others can be hours. And people who leave the consciousness out of the body for minutes to hours will not report an NDE because they didn't get out in a cardiac arrest of 2 minutes. But I know if it, I don't know, it's not a scientific aspect, but I don't know the answer.
I don't know the answer in terms of that particular question, but what I am interested is that there's a transformation that happens. In a child, the experience is powerful enough without being able to be articulated or consciously remembered, but there's a change that happens. And in an adult where there isn't a conscious awareness, then it's difficult to see what changes have been brought about.
Exactly.
And so I see that where there's been the hardening of patterns of thinking, that's where the breakthrough happens, where there is a very distinct experience and a recollection of that experience. And yes, I think that that's a very important factor, that where there has been a recollection of that experience, you don't come back the same. And yes, you do come back feeling that you're in bondage. And people who go through deep meditation experiences, and I can report the same, that there was a very specific moment in which I had an out-of-body experience through meditation, in which I was unaware of my surroundings completely. And then when I came back, I was different. I had changed. And I know that the ND does the same for people, but I didn't have to die.
No.
Or in a sense, you know, spiritual language is actually that of death. Whether it's Christianity or the East, they talk about a living death and a rebirth when you go through a major transformation in your awareness. So in a way it is the death and the new birth. It's been recorded through centuries in scriptures.
I know.
But this factor of coming back changed, and people usually report how they're no longer interested in material gain and material possessions, but they're interested in the more subtle spiritual aspects of life, and the fact that life isn't just for the limited things, but life is for a higher purpose. And it was interesting to hear you describe some of the components of that.
I agree. And when you realize that about 2 million people in UK must have had an NDE, if they all want, it's the free will. They want to accept this experience, and family and friends are willing to listen to them without any prejudice, so that they can integrate the experience, the whole society will change. There are so many people with this insight, but because they don't integrate, because the society will not see it as a possibility, the scientific world, but also most other people. So I think it's so important that people get open for it and open for the change. It will be a critical mass which will be needed, I think.
I loved your story of the cardiologist who stood up and the patient who responded. I'm going to quote that story.
Yeah. I'm always asked about what my colleagues think about my work, and I always answer them, you should ask them. Because most didn't hear any story about it, because they don't listen, they don't. There was a patient who said, physicians have to learn to listen. And then I say, you're right, but nurses have to learn to listen as well. And family members have to learn to listen as well. It's the whole society. We have to learn to listen without prejudice. We have to, and because of all the things we learned as a child in school, that we are not open anymore.
It's very interesting for me to see how, although the Western world claims to be a world of logic and reason, when it comes to things that they haven't explored, logic and reason doesn't apply. The door is shut for logic and reason. And then it's just, well, I believe this. And it's actually quite spiritual language they use. But it's holding on to material beliefs that they're using it. It's as much a commitment to that as a spiritual person would have to their beliefs. But logic and reason then just doesn't come into the picture, it seems.
Exactly. That's the problem. Yeah.
Hello. Yeah. I have just one thing that puzzles me, and it has for a long time, and I wonder what both of you think about that, is that quantum physics, the whole idea of a field effect is quite attractive because it matches with that. But I can't reconcile that with this sense of individuality, because a field is generated again by something. I can understand thoughts creating a field, but those qualities that you mentioned, consciousness, self-identity, thoughts, cognition, and the fact that you have your own very personal set of memories, perhaps how you reconcile that with that kind of model. And I'd be curious to hear Sister Genti's thoughts on that as well as yours, just because that is the thing that I'm curious about.
You have your personal field of consciousness, it's more the physical part of it as well. But everything is connected on different kinds of levels. So you're connected with your own field, but you're connected on a different level. All human beings have been connected. You're connected with nature, with animals as well. The experience of oneness, they call it as well. And you're also connected with the divine consciousness. Everything is there. But what about quantum physics? It's not only the field theory, but in the Western world, science has to be objectivity. But it was not anymore possible to explain everything by objectivity. So quantum physics started to explain things but couldn't be explained by the Newtonian physics. And then later on, the last 40 years, they included consciousness, subjectivity as the essence of quantum physics. They say when a physicist has an idea in his consciousness and designs an experiment to prove this idea, then the result of the experiment comes from his consciousness. So consciousness is essential, and it is subjectivity into science. And I think the quantum physics it's very good. You compare it with all the other things we experience. You cannot prove scientifically that someone is in love. You cannot prove that someone loves music or loves a painting. There's no science for it. But it is the most intimate thing you know as real for yourself. So I think we have to include subjectivity and consciousness into science to change science and to change the way we view the world, because the world we see is derived from our consciousness.
I'm interested in this fact that if a scientist begins with a certain idea and he creates an experiment or handles an experiment, and it's actually his thought form that's transforming the situation and is then creating the results that he had actually expected. And so to what extent is it that our minds actually determine the state of matter, and how powerful is the mind, and what is the power of our thoughts if we're actually influencing matter in that way? And if that's the case, then can we say that it's our mind, our thoughts, or that which is non-material, which is actually primary rather than matter?
But each building we see is a product of thoughts, a material and each art or music is a product of your consciousness, but it's the material aspect of it. So it starts indeed with our consciousness. I totally agree.
That's great.
Yeah.
And I think everybody here would agree with the statements you've made.
Yeah.
And I want to take it a step further, which is actually also the reality of our experience of life, that every situation that happens is a direct result of our thoughts and our state of consciousness. And so the condition of the world at the present time is a result of our state of mind and consciousness. But equally, if we want to create, I love this statement of yours also, the power of love. And so if today we were to create that consciousness and that awareness, it's actually within the realms of possibility that we can create now, even though it seems to be a time of great darkness, Yet it's actually within our capacity to create a world of love and a world of truth and peace. And then, how do we set about it? What do we need to do to make that happen today?
To start ourselves. We have to start ourselves. Yeah. Can I ask a question for audience? How many people in audience do know someone with an NDE? Quite a few. And how many people in the audience did have an experience in NDE themselves?
I love it.
Yeah. Incredible. It's quite a lot. Yeah. Thank you very much. Yeah. Quite a lot. Yeah.
Would you like to make a comment or ask a question?
I don't.
You need to wait for the microphone to come to you so we can hear you. If you could stand up.
Sarah, should we ask for the house lights to work?
Could you put the house lights up just a bit? Thanks.
Yeah, no, I can see.
Now we can see you. Can you keep your comments fairly brief, if possible, please?
This is a subject that I've thought about all my life because I have epilepsy, and seizure phenomena obviously takes you out of your body and into an altered state of consciousness. My experience, I didn't call it near death. What I always called it was a partial death. But that meant that you came back as a rebirth. The other thing I want to comment is my experience of suicide. And again, what that means about the living of the soul, right? The conscious wish of an individual to take their life, their physical life, can also be a rebirth and contribute to a general consciousness that again takes it back to the soul and the effects of change that come about through the soul. So,
Thank you.
Yeah.
Thank you for sharing.
I would like to comment on suicide, if you permit it, because there have been some studies about patients who had committed suicide but didn't succeed. And those patients who didn't succeed in the suicide, who had an near-death experience, never tried suicide again. Because they experienced that the trouble and the mess they want to leave, they took it with them. And it was quite impossible without a body to solve those problems. Though they knew now, because of the near-death experience, that you have to solve your problems while in your body. When you're out of your body, it's impossible to solve them. That's an important message. They use it also for suicidal patients as well. Mm. Yeah.
I've had some discussions with my patients on that. Just theoretically, what if they committed suicide and they still existed? How would they cope with that?
Yeah.
So I think that surprised some people. Has anyone else got a comment or a question? This lady here.
I'm interested to hear from Sister Janti and Pim about, you commented on somebody saying that there was all thoughts perceived in the same moment of not only what they'd done to somebody else, but the impact that that had had on the other soul. And that was all perceived, you know, as though there was a sort of an accountability process happening. I'd be really interested to hear your comments on that.
Sister Genty, do you have?
I believe that yes, there is absolutely the state of accountability, and what I do has an impact on another and maybe many others, and also on me. And so it's both sides that I'm concerned about. And through understanding, through transformation, one is able to sort the things out within the self, but also in terms of relationships, one has to find a way of sorting things out there so that that particular account can be settled also. And yes, I agree that everything has to be settled within the body rather than out of the body somewhere. And this actually is the factor that leads me to believe that the individual consciousness is an eternal individual consciousness. And so I, the being, the spiritual being, the identity of the spirit, there is continuity definitely beyond death, or so-called death, but also that I retain that individual existence through eternity.
As an aspect.
Is it associated with the philosophy of karma? Is that the word that people would use?
Yes, Sarah, it is the word people would use. Karma is the subject that we're talking about, actually. When we use the word accountability, then the word in India, karma, means action. And when they talk about the law of karma, the law of action, and it was very interesting how you positioned it in your presentation, that whatever it is I do to other people, that's what comes back to me. And so it's a very simple expression, but it puts it across very, very clearly.
What's striking for me to learn from all those patients with an ND is that each thought you have is also an energy. Not what you say or what you acted, it's about your thoughts. And when you try to do an act that you're appreciated, then it's the thought behind which is wrong. So the act is wrong. When you really want to help someone, the act is right and your words are right. When you want to be kind for someone, the intention is wrong, so the act is wrong. That is what I learned. It's so important to realize how important it is how you think about yourself and about others.
Yeah. Absolutely.
Yeah.
Take your pick. Maybe someone here, this person, do you want to stand up? I'm afraid we're really not going to have time for all questions because I'm going to finish at 5 to 4.
That was the most powerful presentation I had ever experienced in my life, Dr. Pim. My question to you is, have you ever experienced, or rather come across people to what happens to their consciousness once, I'm talking about the people who have had as experimental head transplants, which Russians have done, or those who have had partial organ transplants. What is their experience in terms of what happens to their consciousness?
Yeah.
Thank you.
Well, for me, in your body, each cell in your body is connected with consciousness. And when you realize that cell death is totally different with physical death. Each day, 50 billion cells in your body are replaced. And each year your body is new. But there's a continuity of your body. And who organized it? It is a kind of consciousness. And each cell has access to this consciousness. So when you transplant a living organ, like the heart of the lungs especially, and in my opinion, the DNA in each cell, which is a person-specific part of your body, which is created by the conception. This is the reception ability for each cell to have contact with your consciousness. When you transplant an organ, living organ, with functioning DNA, this will still have the reception ability of the personality of the deceased persons. And there have been also a discovery. The program was called Transplanted Memories. I mean, you still have the possibility to experience aspects of the personality of the deceased person. And there have been stories, anecdotes, but also about 12 anecdotes who really were by physicians checked out, and it was all right. We tried to start study on this in transplant centers. They don't want to cooperate. That's enough. They're afraid.
Yeah. I'm afraid we have time for one more question, but There's a lady here. Do you want to stand up? Yeah. Dr. Pim will be with us. Stand up, yes. She'll give you the microphone. Dr. Pim will be with us when we're having tea after this session, and he's agreed that if people want to ask questions or discuss things with him, he will be available then. Yes.
I'm a care worker, and I worked with. I had a client who was paralysed. She was in a coma before she became paralysed, and she said that when she was in the coma, she's a Catholic, and she prayed to the Virgin Mary a lot. And she said that when she was in the coma, she saw a vision of the Virgin Mary, and she said that she wanted to go out, she wanted to leave the world, but the Virgin Mary said she should come back into the world, and then she recovered, she came out of the coma, and she's a very spiritual person. She used to pray the rosary nearly 3 times nearly every day before she died, before she was in the coma. So that's my experience.
Okay, thank you very much.
Thank you. What is striking for us as physicians, that they have a possibility for regaining health without any, what you didn't expect. Patients in coma for weeks can be at home after 1 week without any complaints anymore. It's incredible. And they also have the possibility to, I would call it the divine energy to heal others, and the divine energy to heal themselves as well. It's striking. It's the miraculous aspects of NDE as well. Yeah.
Okay, I think the time has come for us to make the transition to our next phase of this talk. So I'd like to thank Dr. Pim again. Thank you very, very much for a wonderful talk. And now I'd like to invite Sister Genti to take the centre chair and take this label off. One thing that Dr. Pim had on his slide was not that that I am conscious, not consciousness, not that I have consciousness. So I would be very interested if you could tell us a bit more about that, what that means, that I am consciousness, in your address. Thank you.
Thank you, Sarah. And again, very sincere thanks to Pim. Really very powerful presentation with lots of stimulus for everyone's minds, but also hearts. And Daddy Janki phoned just a few hours ago. And yes, her thoughts and feelings are very much here with us in this room. And she's in a place called Ahmedabad, which is just near our headquarters, Mount Abu. And she knows that you've gathered here together today, and she's sending you her very deep love. And so I can't imagine what she would have said to you. And I'm not even going to try. It's not possible. But all I can do is to share with you some of my responses as I was seeing the presentation. And I'm very, very interested in the fact that ideas that are as old as a few millennia are now being supported by science. And I'm thinking about, although those ideas are very, very old, yet for the last couple of 100 years, there's been such a departure from the ideas of the spiritual dimension that we've really become locked into the material plane completely. And anything that I can't touch and feel and measure and weigh, I'll say, well, maybe it doesn't exist. And yet today's science is actually opening the doorway for us to be able to understand the things of consciousness. Things that yogis have experienced just simply through their own inner research and spiritual knowledge are the things that are now being confirmed. And yes, this particular sentence struck me also, that it's not that I am a body, but it is that I, that being of consciousness, have a body. And it's not that I have consciousness, but that I am consciousness. And most people wouldn't even be able to see much difference between these lines. They would say, oh, you know what you're talking about. But yet, of course, it represents a very, very fundamental shift of understanding and awareness. And so, who is it that I am, and who is it that's speaking? And so, I am consciousness, and I am the one that speaks. And yes, that's not to negate the value of the body, but absolutely the soul can only express itself and do what it needs to do through this very precious vehicle, this chariot, this body. But to know that I am consciousness, that I am a soul, means that I have a very different attitude to what's happening with this body and how I interact with others around me. Some of the things were described in the slides that Pim showed in terms of what is it that happens when I experience that I am consciousness separate to the brain, separate to the body, and the accountability factor that comes in, and that sense of oneness with others that also happens. Maybe I'll be one of that tiny percentage of individuals for whom an NDA happens, but there's no guarantees of that. And I wouldn't wait for a transformational experience to happen on the basis of that. But what I can do is to actually study these ideas of consciousness and see, well, what is it that's consciousness and how it is separate from this physical body of mine? And in what way can I develop my awareness so that I'm able to maintain that consciousness as a human being involved in all the things that I need to be involved with, but yet keeping that awareness that it's consciousness that's primary. And there's a word that they use in India, and it's a word that we were thinking about this morning in our lesson when we came together to study together, and that's the word mastery, sovereign. To be a sovereign of the self, to be a master of the self. And so when you say that, yes, primary is consciousness, and then secondary is matter, not even thinking about the world outside and around me, but just thinking about I and my relationship with matter here, this body of mine, and in that awareness of I, the being of consciousness, then in that state, I am totally responsible, yes, for my thoughts. And yes, it's fascinating to hear the research and the evidence that it's not even so much the question of the action you perform, but the motivation behind the action, the thought behind the action. And so all these are very, very powerful signals for all of us to be aware of and what it is we're engaged in at this moment. And maybe what I need to do is to actually be able to experience that separation of soul and body, consciousness and body, and then within the body become the master of this. So that it's I, and I'm pointing here, and again I was interested that you commented that when people talk about re-entry, I don't know where other people talk about in terms of re-entry, but you specifically mentioned re-entry through the head. And so our understanding here is that the location of the soul is here, just in the center of the forehead. And so in that awareness of just being there and being able to look out, not just through here, but I am here, and I then look out through these eyes. And who do I see? What do I see? Then it's not this that's primary and the divisions that exist between this and this, but the connectivity. I, the being of consciousness, am able to see you as the being of consciousness, and there's a connectedness that I'm able to experience, and through that, so much of the division that exists in today's world, the conflict that exists in today's world, it could actually be resolved so quickly. Just to be able to see each other, and I'll use this word soul, because it's shorter than the word consciousness. And so when we see each other as souls, beings of consciousness, then really it is one family. It is one human species. Again, it was very interesting when, I think it was in the 90s maybe. Yes, that's right. It was in the 90s that scientists first presented us with the complete breakdown of the human genome, the genetic code of human beings, and how really whichever part of the world it is you're from, whatever race, religion you're from, doesn't matter, but the human code is the same. And so it's one family, one species. And that experience of soul consciousness really gives you that awareness of one family. And yes, a concern not just for myself and within the things that I want for myself in one limited lifespan, but a consciousness of something beyond, and a recognition that there's going to be continuity and a return for everything that's happening. It's going to come back. And so we're connected together, we're connected with nature, we're connected with the planet, but we're also responsible. Not just a connection, but a responsibility. I'm very aware that the subject of individuality is a subject of karma, which means that my personal karmic account, I'll use that language now, my personal karmic account is very individually mine and isn't going to disappear, which is what the whole subject of suicide attempt was talking about. I carry all my things, my baggage, my burdens, my credits, my debts, everything with me. And so if things are a problem here, then wherever else, I'm going to carry those problems with me too. And so my karma is something that's carried intrinsically within consciousness, within the soul. And I retain that individuality through eternity. And the very interesting thing for me is that, well, how do I come to a point where I actually am able to settle the karma that I've created? And then suffering, pain, all of that experiences one way of settlement. But the other way of settlement is the experience of God's love, the connection with God, and through the Supreme, the absolute being of love, being able to sort out and settle things. Science and spirituality coming together today are giving me a very powerful signal of how important this particular time in history is now. People reporting the NDE, people able to talk about it in a public forum, a scientist able to share these ideas so that others, probably those who are here, already believed in consciousness and the ideas that were presented. But beyond these walls, it would be very interesting to hear these ideas being taken up by the world out there. And yes, I think it's a question of critical mass. As we come to that state of the power of love, which reaches a point of critical mass, I think the eyes of others will open and they'll be interested and they'll be wanting to know more about these things and come to find out too. But that state where today with science we're coming so close that we're able to understand the borderline of that which is of the spiritual dimension, and then the exploration in the spiritual domain of going into the self and discovering the secrets of mind, of consciousness, of personality, but also of being able to develop and refine all of these aspects within the self. It's interesting that it's a cardiologist who's presented these ideas here today, because one of the words we use is heart, and now I'm thinking not just of this heart, but the heart in here. Did you know that there was a heart in here? You thought there was a brain in here, but in fact the heart is also in here, in the sense that when we talk about feelings and emotions, then we're describing the condition of the heart, but not this, but the soul. Silence, meditation, the journey inside, all these are the ways in which we're able to understand what's going on within, but we're also able to transform the feelings of our heart, our attitude, our vision, and through that our relationships with each other also, and the whole process of together creating a world of love, I think is actually right now a very powerful possibility. There's 1,000 things to say, but what I'd like us to do is to actually go into an experience. So I don't know who's been through a near-death experience through meditation already. Some of you indicated that you've had an NDE on a physical level, but I'm sure many here have had the experience on a spiritual level of an NDE also. But an invitation to go out of the body now. What I'm going to do is to speak out my own thoughts as I meditate and invite you to follow those ideas. Sitting comfortably, letting the body relax, and yet letting the mind be alert. I go on a journey within. I go inside my own mind. And I see the tangle of thoughts. Many thoughts scattering in many different directions. But I go deeper than that tangle. I go deeper within myself. And below the surface, there is stillness. I connect with the stillness within. The quiet space. The sacred space inside myself. That no one else can enter. And here, in this space of peace, I discover that being that I am. A being of light. A being of love, of truth, of joy. This is the original state of being, the original state of consciousness that I am. I recognize that through my journey, I've accumulated dust and dirt along the way. But deep down, I hold the memory of my original state of being. And I connect with that again. And in this awareness of my original state and the pure qualities of the self, I know that this body is my costume. It isn't I. I have adopted this costume, but I exist quite distinct and separate from this costume. All that I am is within this inner being. My memories, my experiences, all the things that are most precious, the most valuable, are all contained within I, the soul, the being of light. With the power of my thought, I can move away from the consciousness of my body and be detached from this body and see the body separate to myself. And in this awareness of I, the being of light, I'm open to receive the signals, the messages, the vibrations of the being who is absolute, absolute love, absolute truth, the Almighty. And in the presence of the Supreme, I can fill myself with unconditional love, and connect with the Supreme Source, the being of light. the love of the Supreme reaches out into the entire universe, hope awakens, light returns, souls are empowered through this love. I stay connected with this light and come back into the awareness of my body, this room, but even as I return, I hold this awareness of my true identity and my connection with that supreme light. One of the things that I was always struck by when I read and heard of NDEs was the light at the end of the tunnel and the experience of unconditional love through that. We can make contact with that light at any moment we choose. Thank you. Om Shanti.